Good time, everyone. I am Dr. Mahla Daliri, and I'd like to provide a brief overview of the Fixodyn-Anatomic and dynamic external fixators. From historical point of view, early designs for the internal fracture fixation devices relied on crude and limited elements that needed to be adapted to each fracture type. However, with the advent of locking plates and the conduction of anatomic studies focusing on the articular ends of lying bones, anatomic plates emerged, sparking a revolution in orthopedic surgery. These plates can be utilized in a minimally invasive manner with a lower profile and a more robust fixation compared to traditional articular plates. By adhering to the anatomic principle, these plates match the native anatomy without necessitating intraoperative contouring and thus saving valuable time during lengthy procedures. Considering this historical progression in internal fracture fixation, our current concept extends to achieving the similar advancements in anatomic external fixators. Unlike this type of traditional external fixators, the Fixodyn fixators can be customized to adjust the unique anatomy of each patient and thereby facilitating a more precise reduction of the fracture fragments and promoting patient outcomes. Our startup company specializes in providing anatomically designed and adjustable external fixators tailored to address the prevalent orthopedic injuries. Our flagship products are the anatomic and dynamic distal radius external fixator and the anatomic and dynamic hip external fixator, which offer the innovative solutions. The first product is the anatomic and dynamic distal radius external fixator. Distal radius fractures represent the most common fracture in adults, showing an overall prevalence of 17% with respect to all the fractures and are typically result from falling on an outstretched hand. Many factors have been proposed to determine the source of the increasing rates of DRFs, including lifestyle, environment, rise in life expectancy, and osteoporosis rate in elderly population. Now, I'm going to explain the behind concept and innovation of these external fixators. With traditional method, when force is exerted in parallel to the radius shaft, displacement of the fragments and articular step occurs as a result of shearing force. Using the anatomic and dynamic external fixators, we can exert the traction force perpendicular to the articular surface with adjusting the two joints of the external fixator according to the palmar tilt and radial inclination. When force is directed perpendicular to the distal radius joint surface, the reduction of fragments occurs more properly. This external fixator is composed of two adjustable clamps, a distraction knot, and shunt pins which can be inserted in multi-directions. Furthermore, the dynamometer controls the distractor force and prevents the over-distraction and its complications like stiffness. It has got low profile with less than 100 gram weight. The biplanar adjustable joints allows us to adjust the angulation in two directions according to the patient-specific fracture type and anatomy. The joint that moves in vertical surface, the proximal joint, is equal to the intact size palmar tilt, and the joint that moves along the horizontal surface, the distal joint, will be equal to the radial inclination. The gradual distraction of the clamp is facilitated by a distraction knot between them. We can fix the shunt pins in multiple directions, so simple with this external fixator. And this is how we implement the external fixator on the patient. Two pins are inserted in the second and third metacarpal bones, and two pins are inserted into the distal radius shaft. The gradual distraction of the clamps is exerted by a distraction knot between them. We then angulate the joint that moves in vertical surface equal to the intact side palmar tilt and the joint that moves along the horizontal surface equal to the radial inclination and tighten them. The distraction force is exerted and the fracture fragments will be reduced properly, avoiding the step formation. This product is now commercialized and available in market. The phase 2 and 3 clinical trials are published and post-marketing trial is ongoing right now. And this external fixator is also backed by the US patent. The next innovation is the dynamic hip external fixator. Intertrochanteric fracture is a common fracture, and the trend is also growing with an increasing aging population and the prevalence of osteoporosis that continues to rise. Due to the elderly population comorbidities like diabetes, cardiovascular disease, or hypertension, the preoperative mortality rate is significantly high in this type of fracture. The innovation is an external fixator for patients with intertrochanteric fracture. The elderly with chronic conditions like diabetes, pulmonary heart disease, and pulmonary hypertension who has poor surgical tolerance are more likely to suffer from this fracture. This external fixator has a sliding part similar to the dynamic hip screw or DHS that compresses the fracture site. It utilizes a sliding mechanism to apply the external compression force directly to the fracture site, enabling compression without open invasive procedures. In contrast, the dynamic hip screw, the current standard internal fixation method, necessitates the open surgery. We can fix the shunt pins in multiple directions, so simple with this external fixator. The shunt insertion is away from the hygiene area, and this is how we implement the external fixator on a patient. 2 shunt pins are inserted in femoral neck and 3 others in the femoral shaft. And finally, by sliding the fixator head, external compression happens at the fracture site. During our clinical trial study, the intervention group who treated with the dynamic hip external fixator, the mortality rate, operation time, and post-operative inpatient time were all dramatically reduced according to our findings, in contrast with the dynamic hip screw patients. Open reduction and internal fixation is considered the gold standard for treating such fractures and are associated with increased blood loss during surgery and heightened surgical risks. Reduced compliance among elderly patients with several medical comorbidities make fatal complications almost inevitable, leading many surgeons to hesitate in performing open surgeries. To address this complex scenario, external fixation emerges as the optimal solution, which utilizes a sliding mechanism to apply the external compression force directly to the fracture site, enabling compression without invasive procedures. This product is patented in Massachusetts General Hospital, MGH, and is now available in market with supportive clinical trials. Thanks for your attention, and for more information, please visit our website, thefixodyn.com.